further ado, let's talk about what is missing from your clinical toolbox. And today I would like you to go ahead and silence notifications on your phone, because we are going to teach you some concrete steps that you can take to your practice right away. And so let's listen up and stick with me to the end so we can show you ways around the challenges that you're facing with gut health. And go ahead and put your questions in the chat thread, or if you're in Facebook, you can put them below, and we will go ahead and try to answer those at the end as well. But let's talk about this point right here. You know, I have to say, I learned the hard way how essential these points are. Not getting good client outcomes and not standing out as an expert in my field and really not getting my clients wildly satisfied. But we're going to learn how to do all that today. So I want to just first take a minute to introduce myself to you, because I know I've been running this group for many years, but some of you may not know a little bit about my past and what's happened with me in terms of my learning. And I have to say, I started this when I turned 50. I got educated. I decided this is what I want to do. And I went ahead and got educated in nutrition and some functional medicine. I did a lot of self-studying too, listening to podcasts, reading books, etc. And I decided this is it. I want to do an online practice. I did some in person as well, but immediately I felt like I was over my head. And that was really hard, a hard pill to swallow. I had major insecurities, and I felt like I was trying to help people, but the interventions I was doing weren't very effective. And maybe I would give them something that would help them, and maybe they'd take 2 steps back from that. Some of the things were actually things were going worse for them in the beginning. And even my very first client who came to me had come to me for weight loss, which I felt confident I could help her. But when I went further into her health history, I saw that she had type 2 diabetes, a rash all over her skin. She had chronic diarrhea. So talk about gut issues. She had had this for 40 years and had to wear an adult diaper because of it. It was like, you know, really, she couldn't go to concerts. She couldn't go to sporting events. She was a teacher and always worrying about having an accident. And she had been to multiple practitioners that scoped her and basically told her to take Imodium. There was nothing wrong. So she was suffering with that. She was also suffering with acid reflux to the point she couldn't lie down and sleep at night because it bothered her so much. And of course, she was on lots of medications for PPI and things that were supposed to help these, but it wasn't helping very much. She wasn't sleeping well. And the interventions that I was trying really weren't working. I was trying to get her to lose weight. And of course, adding more vegetables and increasing her diet was just making her diarrhea worse. She was craving sugar. So even getting her to cut down on sugar was hard because she was diabetic. The acid reflux wasn't getting any better, so she still wasn't sleeping. So she was feeling hungrier and hungrier. And she couldn't exercise because her fibromyalgia and joint pain were so severe. She couldn't even cross her legs when she was sitting down. So I just felt like she had already been to a Western practitioners, and they weren't helping. So I needed to really up-level my skills in functional medicine. And it was really disheartening not being able to help her. I had no confidence. I would try my best. I wasn't getting results for her. Her diarrhea was getting worse. And really, frankly, she wasn't very thrilled with my services. And this was happening with client after client. I had people ghosting me. They would come to an appointment and then maybe not show up for the next one, or they weren't buying into my full program. I sometimes would put my head on my pillow at night wondering if I had made the right choice, because I gave up something else to do this. And I'd put all that time and energy into my education, and I wasn't being able to help people on the level that I knew I could have been able to. I wasn't having any impact. And my business was suffering too. I mean, I wasn't making any money. I wasn't charging very much. And I wasn't getting any referrals because nobody was really wildly satisfied with my services. I felt like my intake was kind of weak. I wasn't really sure what to do with the questions that were the answers that the people were giving me. And I really wasn't sure what to do each session. Was I doing things in the right order? It was really kind of a disaster. And I really was honestly getting some anxiety over this. And, you know, it was very difficult. I was ready to give it up. But I want to tell you that things changed for me in a big way. I found the School of Applied Functional Medicine, for which Tracy is the founder and lead educator. And it was life-changing for me. Tracy, I saw her at a talk, and she was saying things that I'd never heard before. Even in the 1 hour that she was doing that talk, I learned more than I think I've learned the whole school previously. And I was just blown away by her knowledge, because I was reading the books and going on Google and searching things and researching and trying to do my own things. And she was saying things I never heard before and things that I could take to my practice right away. So I dove into the school and I started gaining confidence and I started feeling more competent. And that client I was telling you about with the diabetes and the rash all over her skin and the diarrhea and the acid reflux, well, guess what? Everything went away. Within 3 months, her diabetes was gone. Within about 4 weeks, her diarrhea was gone. Her acid reflux was gone within 2 weeks. And within 8 months, her fibromyalgia pain was gone, completely gone. She went off all her medications, which was just crazy. She was on 6 medications. And I started feeling great about it. I mean, she started telling people, standing in line, literally at a grocery store, telling people about me and referring client after client to me. And so this happens to be all the time now. I get so many referrals, I cannot keep up with demand to work with me. And as a result, supply and demand, I was able to increase my rates over the past 8 years, over 1,000% from what I was originally charging. So take your rate that you're charging now for your patients and, multiply it by 100 and that, or add a 0 on the end and multiply by 10. Actually, that's how that works. But yeah, so it was really, it's been life-changing financially for me, but more important, the results I'm getting from my clients are breakthrough results. I'm almost afraid now to post testimonials, because every time I post one or a client success story, I get about 10 more people that want to come work with me. So I've expanded my practice as a result, and I hired more team members. And honestly, it's hard to find SAFM graduates who are already not too busy to take on new clients or new patients, but I was able to find a few, and they're getting all booked up now too. But I also am starting group programs so I can have a lot more impact. And I became completely passionate about what I'm doing. People come to work with me worldwide, and I don't do any advertising. They just come to me because they heard about me. So this is the kind of success that you can expect with this program. But I do want to show you, Tracy's going to give you some concrete things that you can take to your practice right away to help you. But I do want to talk about this client that came to me also. This is Beth. And she came to me with such extreme fatigue that she was in bed by noon every day. She was in such pain from her headaches and fibromyalgia that she could not get out of bed. She was on Vicodin, daily doses of Vicodin. And her urticaria was horrible. She had hives all over her skin, all kinds of horrible GI issues, and not surprising because, as we know, GI is a lot of disease begins in the gut, and that was certainly the case with her. And she was honestly very depressed about it. She couldn't be a mom to her kids. She's also had gained about 100 pounds or so over the course of the year. So that was really disheartening for her too, over the course of a few years, that she was so debilitated. But using the resources that I had at SAFM, and I took her on within the first 3 months of my learning at SAFM. So the thing that I was a little nervous about is she had already been to multiple conventional practitioners and a functional medicine doctor already. And I was thinking, gee, I'm just in my first semester learning, and am I going to be able to help her? But I knew I had so many resources in the school that I felt confident that I could already help her with this. So fast forward, we worked together for about a year. But even within the first few weeks, her migraine started going away and she was able to go off the Vicodin. And we just worked and worked together on one thing after another, and every single symptom went away. Her hives went away, her joint pain went away. Hashimoto's, I didn't even mention, is gone. Her antibodies were cut in half, her thyroid antibodies. And she feels fantastic. The only thing she's still on now is a little bit of a thyroid medication, but she was able to go off her other medications, and she feels fantastic. You could see that in the process, she lost about 90 pounds working with me, and it can be a mom to her kid again. So the ripple effect just gives me chills of what I've been able to learn, how many people I've been able to help with this. And as a result of her success, of course, everybody asked her what she's been doing. I've gotten so many referrals. Even her doctor wanted to know what she was doing. And Dr. Bob, thank you if you're out there, but he has referred so many clients to me, one after another. And I didn't realize that this was her doctor. I was trying to figure out where are all these referrals coming from Dr. Bob. But anyway, so you can see what a ripple effect this can have. One more case I want to show you is this case, John, who had psoriatic arthritis, and he was in such excruciating pain. He could not tie his shoes. He couldn't do his work. He loved to do woodworking. He was obese with limited mobility as well, but you can see down below, his before is up above with that's his thumb in the top left corner. You can see his psoriasis is gone there. So he is healed. He's pain-free, and he's off his prednisone, which is just amazing. So this is what the power of gut healing. As you know, many of you know, psoriasis really does begin in the gut and impaired digestion. And so we worked on that, and really miracles happened. His pain's gone and he feels fantastic. And by the way, he's referred a lot of people to me from his state. So that's really exciting too. But let's talk about why you need to up-level your clinical toolbox. As I mentioned, I had so-so client outcomes. I was feeling frustrated and unfulfilled, but it was really hard. And I felt like this made such a huge difference for me. But if you're experiencing slow growth and you're experiencing not enough income and it's tough to get new clients and you're feeling this imposter syndrome, definitely look into the school, and we'll tell you more about that. But I do want to introduce my teacher to you. So Tracy is the founder and lead educator since 2011 of the School of Applied Functional Medicine. And she's a scientist by background with actually 3 degrees from MIT. She's done extensive training at IFM, done all the coursework there, and also a lot of postgraduate work like nutrition from University of Bridgeport, et cetera. So Tracy, thank you so much for joining us today. I so appreciate it.
Yeah, thank you, Jodi. I appreciate the opportunity. And I love your case examples, right? It's so inspiring to see, and I get the pleasure of doing it every day, right? In terms of seeing the benefit of functional medicine and just celebrating that we get to be sort of alive and doing this work during this time of discovery and impact. But I just want to say your story makes my heart sing so much, because there are so many practitioners who are passionate about functional medicine. They have some education, but they're not turning it into this spectacularly satisfying career and these truly heart-fulfilling clinical outcomes, which is what it's fully capable of doing. And to me, it's a travesty that there's so many people on the sidelines of functional medicine. They want to have a major impact, but they can't. And they feel somewhat stuck between, I want to have this amazingly successful career, doing this thing, being in the middle of this healthcare transformation wave. I can't go back to what I did before because I know too much now about what's possible. And we've just got to be a vehicle here for helping people to really reap the full benefit, not just for all the people's lives that we know functional medicine can touch, but their own lives, right? That fulfillment, that financial abundance, right? All of those things. Doesn't everybody want to have the challenge of, oh my gosh, I don't know if I should post because people are going to want to, they want to become a client, and you're thinking, but you're going to have to go on the wait list, which is at least 4 months long now. And I can so relate, right? I had the same experience, and I know a lot of people do, but it's a blessing. It's such a source of abundance that I want for all practitioners. So thank you for that story, because that coming back into touch with that really lifts me up. It really lights my heart up. But let's get to some content, right? Let's do some geeking here, because I want to talk about the gut. And let's go into the first, I queued up a couple of cases here in order to demonstrate some key points about functional imbalance in the gut. And I have a real passion about this because too much of functional medicine is trying to be applied just through the lens of advanced labs. And in the realm of the gut, largely the clinical approach these days, and many people, not all, but for many practitioners, is about run a stool test, treat the results. If there's recurrence, run another stool test, treat the results. And while that may be helpful, sometimes I'm not sure it's helpful at all, but while that might be helpful, what I'm seeing now is a real epidemic of disease recurrence in the gut or slight improvement of gut dysfunction that leaves people feeling hopeful and motivated based on 20% improvement, 30, 35, 40% improvement, but that frustration that there isn't any full resolution, right? People don't fully get well and stay well. And I think this has everything to do with just a lack of really rich confidence and competence in sustainably addressing gut dysfunction, really getting at those underlying imbalances that cause IBS, the underlying imbalances that drive a dysbiosis. We're addressing the surface, right? We're sort of more addressing the icing and the rosettes on the cake, but we've got to get down into the meat of the cake. And I think what we need is, army of practitioners who have that richer, deeper skill, who honestly feel like they can help anyone who walks in their door. And I get the privilege of supporting thousands of practitioners with their cases, which is a wonderful experience. But there's some juicy examples here that are wonderful cases for clinical learning. This 70-year-old obese woman came to, this was actually a pharmacist who was also doing some coaching. But this woman, Marilyn, was suffering from bloating and flatulence, really embarrassing flatulence, and GERD. And I think the progressive GERD was something that was really motivating her to seek help because she was beginning to have a progressively sore throat. Initially just episodically, then it was every morning, and then it was becoming more persistent. And she was obviously concerned about the health of her tissue and how much worse were these GI concerns going to become. And so she worked with this woman, Sue, and I think got a lot of great support. Awesome focus on the basics, many of the things that you and I would think of. Cleaning up her diet, which already had a lot of whole foods in it, but getting rid of some refined snack foods, helping her to really get away from late night eating, which was probably contributing to overnight reflux, helping her with some eating hygiene and making sure that she was really taking the time for good meals. In fact, this practitioner actually helped her with some good logical supplement recommendations as well. Again, things that I think any of us might recommend. A good quality multivitamin with good bioavailable forms of nutrients, a probiotic, a vitamin D, an omega-3, a good quality, clean omega-3 supplement, and also a carminative herb formula to try and help Marilyn with her bloating. Carminative herbs such as ginger and peppermint and fennel can be very effective for this particular purpose. These were all good basic interventions to try and get at why Marilyn was struggling. But here's the thing, right? The results really surprised the practitioner because Marilyn's symptoms with these choices, as basic as they may seem, got worse. Marilyn got worse. She was not getting better. She was getting worse. And so we've got to double down. What are we missing, right? What do we need to consider? And we have to think, what do I do next? So she recommended gluten-free, right? That should probably help with regard to maybe immune reactivity in the gut, and going gluten-free sometimes helps a lot of things. Marilyn still felt worse. Okay, wow, I've got to go and do something else, recommending at this point that we also introduce digestive enzymes, which Marilyn did say she felt like helped a little bit, but maybe 10%. There are way too many cases where this is the flow of events. And so you end up working with someone for a month, 2 months, You know, you've met with them 3 or 4 times. You've tried a progression of items. In Marilyn's case, right, there were very real financial constraints. She did not feel it was accessible for her to get something like a, you know, a stool test in order to see if there was a dysbiosis at play. She did relate to the practitioner that previously her primary care physician had recommended some antibiotics, which, as he put it, should just wipe out what is ever causing that bloating. And as we all know, the antibiotic often doesn't work. And in Marilyn's case, she got temporary relief for about 2 or 3 weeks, and then it was even worse than it was before. Right? But it doesn't have to be that way. This was more of a sort of a grab bag of, well, let's try to address the bloating. Let's try to address what might be a food sensitivity. Let's try to address what might be some type of maldigestion, right? This is not the way to achieve a wildly satisfied patient, or for that matter, a wildly satisfied practitioner. And so we were able to support the practitioner with this, and we needed to nail the nuances of this case. Here's the thing. A lot of practitioners have a lot of knowledge, but it's not deep enough and rich enough to help them to confidently, right from the beginning, see the critical case nuances, see in advance those considerations that are unique to this particular case of IBS, right? When you've seen one case of IBS, you've seen one case of IBS. And I could list for you now 20 different solid profiles of IBS, which have sometimes overlapping, but generally quite distinct root causes. And if you don't address the true root causes in a unique person, it's illogical to expect dramatic resolution that's really going to create that on fire, wildly satisfied patient who can't wait to give you a raving fan testimonial, who can't wait, like Jodi said, to tell everyone they meet, including like, you know, random people in the grocery store, about you and your services. So Marilyn started taking vitamin D. Well, unfortunately, I believe for Marilyn, that triggered a borderline insufficiency of magnesium to become more prominent. And she started displaying some of the classic symptoms of insufficient magnesium, which includes acid reflux. So because magnesium sufficiency wasn't addressed prior to beginning vitamin D, we shouldn't be surprised that her acid reflux actually got worse. And probably to some degree, this was causing a bit more spasming in the gut and also contributing to her bloating. On top of that, there were some other case considerations. Carminative herb formulas are indeed wonderful for addressing gas buildup, especially in the intestines and related bloating, but not when not with peppermint when the person has acid reflux, because peppermint is a known exacerbating factor for encouraging lower esophageal sphincter dysfunction that worsens acid reflux. Great idea. Inappropriate implementation for this unique person. Marilyn, we swapped it out, did much better on a fennel-based formula, and also using ginger tea at the end of some of her larger meals, which was a new habit she loved, and also helped to get some of that bitter herb pro-motility formula that contributed to, along with multiple pieces here, contributed to her acid reflux going away. But we have to go even further than that, because we needed to take a look at Marilyn's history. Too often, practitioners are just looking at either immediate presentation or recent history. Marilyn's 70 years old. She's been postmenopausal for nearly 2 decades now. Most practitioners would not think to go back and ask Marilyn about her prior menstrual experience, but you learn critical nuances about who is Marilyn when you do so. Marilyn had long-standing challenges with heavy menstrual bleeding, long menstrual periods, strong PMS symptoms. And so this speaks to a predisposition for estrogen dominance that may have genetic tendencies. Maybe there were longstanding challenges with methylation or sulfation in terms of estrogen metabolism or clearance. Maybe some of her challenges began in the gut in terms of poor phase 3 clearance of estrogen metabolites. But when we're thinking about what might be causing her acid reflux, we needed to cast a broader net. And in Marilyn's particular case, It was also of note that she loved beauty products. Marilyn talked quite a bit about how much she enjoyed having beautiful nails and her passion for anti-aging remedies and creams and ointments and tinctures. She colored her hair on a regular basis. And we know that many of these beauty products or personal hygiene products can present with a tremendous amount of endocrine disrupting chemicals, especially phthalates in nail products and hair products. And absolutely, women, especially who are obese, maybe long postmenopausally, can still be wrestling with notable estrogenic effects, which I think was very much the case with Marilyn, because in addition to removing all of these products and also really addressing possible challenges with regard to poor estrogen metabolism. In Marilyn's case, we had to consider a component of gut function that Casey had not considered at all, which is hepatic biliary congestion. And ultimately, what Marilyn was struggling with as a upstream root cause of her acid reflux was poor gallbladder emptying. It's a known dynamic that can promote that GI symptom, but it is often not investigated, or it's investigated months down the road when both practitioner and patient are frustrated. But in these cases, all key points of Marilyn's history pointed to this right from the beginning. And in Marilyn's case, we needed to encourage more progressive motility. When there are strong estrogenic states, which is not just promoted by endogenous estrogens, it's also promoted by, can we just go back real quick, Jodi? Sorry. When we're in a strong estrogenic state, we actually promote the concentration of greater amounts of cholesterol in bile, which makes bile thicker. And it's more likely to promote literally hepatic biliary congestion that can build up in the gallbladder and contribute to a poor motility, poor emptying in the gallbladder, that over time we know contributes to the formation of stones and eventual gallbladder disease and precipitates a cholecystectomy, which is not benign at all because we're overtly interfering with phase 3 detoxification when we get rid of a gallbladder and all of the other critical function that the gallbladder offers beyond just helping to digest fats. But in Marilyn's case, of course, her bloating and her flatulence were getting worse, but when she had poor gallbladder emptying, because she had started taking an omega-3 supplement. Again, a great idea in the wrong order of operations for this unique individual. So what Marilyn needed more than anything is to take away the vitamin D and strongly replete magnesium. She needed a different carminative herb formula. She needed support for thinning the bile and for greater upper GI motility, and we supported that with taurine and artichoke. We used extra virgin olive oil, using a good few tablespoons of it daily in order to concentrate the polyphenols, which encourage greater gallbladder emptying. And we use D-limonene in order to help encourage the emulsification of fats that may have built up in the liver and in the biliary tree. And 3 months into this, all of Marilyn's GI symptoms were gone. Marilyn became wildly satisfied. And of course, she starts referring her friends. In this particular case, she referred 5 of her friends from her regular bridge club to Casey. Again, a pharmacist who had a lot of knowledge about looking for polypharmacy, looking for the interactive effects of supplements, but there was a lot of devil in the detail nuances here that were really essential for helping to move Marilyn from being pretty dissatisfied and frustrated to actually addressing the nuanced roots of disease in her unique case. So let's go on to another example, because what I'm getting at here is the nuanced information that you need to know about how the roots of acid reflux can lie in the bile And then what can cause dysfunction in the bile or in the gallbladder? This is where we know the greatest wisdom of functional medicine goes across typical systems and symptoms. And we need to get away from protocols. We need to get away from if this, do that. This leads to a whack-a-mole type of approach that if you get lucky, you will use an order of interventions or an order of addressing disease dynamics that might work in what? 15, 20, 25% of the time. That's a lot of missed opportunity for wildly satisfied patients. Just some example here of some of this nuanced devil in the detail that we teach at SAFM. If you'll page down, Jodi, let's talk about another client, because I got another great example. This one I think is a wonderful case for getting more comfortable with the revolving door of disease, right? Marilyn's experience helps us to point out what we have to do in terms of nuanced case consideration in order to accelerate recovery. But when you start referring all your Bridge Club friends, right? It's because you're becoming known as an expert in your field, not just another practitioner, right? Well, in Jose's case, this is a 51-year-old man who was working with a nurse practitioner, and he was presenting with recurrent IBS. He was struggling with bloating and gas and constipation. And Jose was frustrated because he felt like this was the first thing in his life that he was struggling to get on top of it. He had enjoyed in general good health up until then. He'd had a little bit of a scare from his primary care physician a few years back with regard to early signs of pre-diabetes. But other than picking up a few pounds, he was a happy man. He was a new grandfather, but these gut concerns were worrying him because they were getting worse. And he had worked with his primary care physician in order to try and address the roots. But this had resulted in a couple of different courses of antibiotics. And we all know the revolving door of IBS, what we often assume is the revolving door of SIBO. It gets diagnosed with a test, right? A SIBO breath test. And we treat it with antibiotics and we feel better for what? 1 month, 2 months, maybe 3 months, occasionally 6 months, and then it's right back again. We treat it, it recedes, and it recurs. We treat it, it recedes, and it comes back. This is not remotely close to the best that functional medicine know-how can do when you're applying it with keen, nuanced application. He had actually gone to see a nutritionist who had also tried to help him with this, stepping away from the antibiotics and using some probiotics and some targeted herbal antimicrobials. But again, Jose's experience had been recurrence. In total, twice with pharmaceutical antibiotics and 3 times with herbal antimicrobials. Of course, he was frustrated because he was starting to believe, can I not get well from this? Surely someone knows how to reliably and sustainably help me to resolve this. And so he was seeking out help from a nurse practitioner. And the challenge with helping Jose was that he already had a great diet. He was already blessed with a spouse who loved to cook, and his diet was rich in vegetables and healthy fats. He had already stepped away from the vast majority of grains and any type of sweeteners when he got the prediabetes scare several years back. There was a lot that was going well for him. He was a spiritual man. He was joyful with celebrating his new grandkids. There wasn't necessarily a lot of low-hanging fruit in Sue's view about how to help Jose. But as usual, the devil in the detail is where we need to go. But Sue was convinced that there must be some low-hanging fruit in other lifestyle choices, right? She helped Jose to really make sure he was having good eating hygiene and chewing his food thoroughly and not rushing through his meal. She helped him with hydration, which was a notable concern because Jose wasn't drinking much water. She noted from lab assessment that there was an opportunity to boost magnesium, as we discussed, in order to help with appropriate contraction and relaxation of all tissues, including the gut, and maybe to help his constipation. zinc in order to promote good potent immune function and to promote tissue health. She had even recommended a different, more targeted probiotic with high levels of bifidobacter species in order to try and counter the constipation. She thought, given his age, that perhaps Jose needed some support with stomach acid, right? All, I think we would all agree, logical, common teachings of functional medicine interconnectedness, right? Looking in multiple nutritional and physiological and biochemical arenas, right? But here's the thing, Sue is addressing all of these things, and she was even helping Jose to reduce his stress, promoting his innate practice of prayer, encouraging him to have better access to fresh air, getting to bed a little earlier, right? Going for brisk walks. And so he was getting some exercise every day beyond his twice a week tennis game. This was all very appropriate, really excellent lifestyle interventions. But here's the thing, Jose was still suffering. It wasn't enough in his particular case. 3 months later, he's frustrated. Sue is frustrated. We're not addressing nearly enough. And Jose was not remotely interested at this point in spending money on yet another test to say, yes, there's a dysbiosis, so you could take more antimicrobials. If we don't address the terrain that is promoting the dysbiosis in a unique individual, then it's illogical for us to expect Jose to get any resilient relief, and certainly not to get sustainable relief. And so we had to nail the nuances. So we were able to support Sue in this case. Do you remember the pre-diabetes diagnosis? Well, it's a well-established factor in research that all states of diabetes, whether it's early stage, even pre-diagnostic pre-diabetes, type 1, combination type 2 diabetes, they can all promote exocrine pancreatic insufficiency while or in tandem with that endocrine pancreatic insufficiency. And so Sue was able to learn that she should look for this type of promotion of gut dysfunction in every single individual in her practice who had any stage of insulin resistance. She also, we talked quite a bit about the possibility of non-dietary glycemic load, that it's not just food that promotes challenges with excessive glycemic load for a unique individual, but also stressors. And often not mental or emotional stressors, which clearly Jose was not wrestling with, but physiological stressors. And the key nuance in the case that stood out was Jose saying that he had morning fatigue. That's not the kind of thing we should take for granted. We need to do a deeper dive. Jose is a very happy man, right? And he says he sleeps well. And for a couple of months now on Sue's watch, he's been going to bed earlier, but he has morning fatigue. Why does he have that? Well, a deeper dive and inquiry of his wife revealed that, well, Jose actually is in bed a long time, but he does seem to sleep fitfully. And every once in a while, as his wife put it, he has to catch his breath in the middle of the night. Well, that's a dead ringer, we know, for a referral for a sleep study, which did uncover sleep apnea. And follow-on assessment identified high cortisol levels for Jose that were undoubtedly driving up his around-the-clock blood sugar and contributing to that chronic high glycemic load. We needed to address the sleep apnea so that we could address the quality of his sleep to bring down his cortisol levels, to bring down his glycemic load, to over time help to improve his insulin function, to allow full restoration of pancreatic sufficiency, to promote optimal digestion, to counter what was undoubtedly happening, which is Jose is chronically feeding his microbiome maldigested food. So of course he has recurrent SIBO or other opportunistic overgrowths that are creating IBS. This is the type of chain of causality that good, skilled, confident practitioners should be able to spot right at or very close to the beginning of an intervention so that Oh, in this case, 4 months later, not only is Jose feeling fantastic and he doesn't have any IBS symptoms, Jose now has not only normal, but optimal hemoglobin A1C and fasting insulin levels. His CRP went well down below 1 as well. Safe to say, Jose was wildly satisfied and felt confident enough to refer Sue to his family, to his mother, to his sister, to his brother. This is a really big deal. But if Sue had not gotten this deeper, rich, nuanced understanding of applied functional medicine and how to optimize the clinical encounter, Jose would have been just another missed opportunity, a frustration for him, a frustration for Sue, missed referrals, missed abundance, missed everything. And I don't want this to be happening to the majority of practitioners today through the functional medicine lens, which, to be honest, is what we are seeing. There are way too many practitioners suffering in this way. So this is the difference, right? This is the critical difference that I think practitioners need to have in order to be successful, because IBS is not just one dynamic. IBS is not always SIBO. IBS could be many things, and you need good, keen education in spotting all of them proactively and looking across systems and symptoms in order to find the roots proactively early in a unique individual. Right? Oh, I want all practitioners to have this whole other additional foundational training that's not just theoretically accurate, but is giving you that devil in the detail that takes you from education to competence and takes you beyond credentials to get to true confidence and capability. And so what I'm describing here is the reason I founded the School of Applied Functional Medicine, because I'd gotten crazy trained in the science of functional medicine, but I was missing what I needed to know in order to take it to the next level. And so we've been offering accredited continuing education for almost 12 years now that goes beyond the science to get to that critical practical application know-how, and importantly, case after case after case of real life, complex, unique individual practice. Because that's how you go from I know a lot to I am confident I can do a lot in any case that arrives in my practice. Right? Oh, in our full training program, right? You get over 50 2 to 2.5 hour deep dives in real life cases, the majority of which are presented by your colleagues. They're not fake, artificially simplified cases. They're the rubber hits the road, real life challenges that chronic disease is bringing into our practices right now, including, I have to mention, a whole bunch of strange and urgent issues with long COVID and post-COVID dynamics. So I appreciate the opportunity to highlight some of these nuanced concepts in the gut, Jodi, because I think it's essential that practitioners have this additional knowledge.
Absolutely. And I see it so much, just those little devil in the detail, nuanced things that you learn that can help people take them from being really, really sick to being really, really better and getting really wildly satisfied with the work you're doing. And so many people are just, even in this group, I see people posting answers to questions in there. And I sometimes cringe at some of the answers. So I'm thinking that's not right, but I don't have time to police everything in there. But I could tell there's a sense of frustration within the group with some of the things that they're doing and not being able to get the results they want. And it breaks my heart. So I'm so glad you went through those cases, because you guys can see now that you all can see the devil in the detail, that, a rich understanding of functional medicine can change everything for you when you know that devil in the detail. So anyway, I want to talk about one quick other case study, this just to show you this client I worked with, Chrissy, who came to me looking 5 months pregnant and had massive constipation, diarrhea, and gas. She was referred to me by a friend of hers who had SIBO, and we were able to reverse that permanently for her. It didn't come back, which was awesome. But she also had Raynaud's and fatigue and acne. And turns out, just working with her and understanding all those nuances, we were able to completely reverse it. She had been to multiple practitioners, and which she says here, none of which could seem to really understand what was going on with her. And now she feels fantastic. She can rock the bikini and not worry about her bloating and looking pregnant anymore. And she's referred her son to me, who we overcame his asthma, and actually all three of her boys had it, and we were able to reverse all that. And she's referred other friends to me as well. So just an example of how you can use this knowledge in your practice to get breakthrough results for your patients. So I want to talk to you today about the big solution to learning this and doing it at a really discounted rate. So we have an essential gut deep dive course available now from SAFM. Tracy put this together so you could get a taste of what the school is like, but not only that, for just a 6-week all-inclusive course that teaches you what you need to know to help your patients get breakthrough results with their gut. Now, you know, most diseases begin in the gut. And if you can master this one aspect and really understand it and be able to help them and understand all the devil in detail, you're going to be able to help a huge percentage of your patients get really, really well and really vibrantly healthy. So this course is over a $1,600 value. I honestly think, Tracy, you could charge $3,000 for this course because it's 6 weeks long. I went to a 1-day course that was $497. This is 6 weeks of coursework for only $497 today. And we're only going to be offering this. We're only going to be promoting this week in this in our group today. So if you're going to do this, go ahead and sign up for it. Terry's going to put the link both in the comments in the chat thread here, and also if you're watching from Facebook, she'll put it below. So go ahead and sign up for it. You will never look back. You're going to learn so much from it. And it's logically laid out and layered in. So you learn through some case studies and through some just really all the knowledge that you need, and you're going to get a deep, rich understanding of the supplements and everything you need to really help your patients get better. Now, this really the why behind this is, again, so much disease begins in the gut, but your patients, sorry, that's a typo there, but you're going to get fiery growth and abundance. And you'll also get messages like I do on my phone on the right there, just saying how much they want to thank you for changing their life. They feel so much better than they felt even as a child. I wish everyone could feel this way. When they feel fantastic, you're helping these people that really can function well in life because of their health issues, really thrive and have a better life because of what you're doing. So the ripple effect can be just phenomenal and so gratifying.
Hey, Jodi, can we just go back to that page for a second? Because I want to say something that if you're not if you're not setting a bar for yourself, that this is the level of heartfelt message you want to receive for your patients, I want to encourage you to reach for a higher possibility. Because I know from experience, I've just had the privilege of supporting so many people and seeing so many messages like this. You deserve this. People who are wildly satisfied send notes like this. I mean, it's amazing, right? You print them out. They don't just make your day, they make your week, they make your year, because you feel the emotional impact you make. You don't want just people to say, hey, that helped, or, yeah, I'm feeling kind of better. You want people over the moon, right? And it doesn't have to be 100% of your people, right? We got to be really, really realistic. You're never going to wildly satisfy 100% of the people that you work with, but it also shouldn't be this crazy rare exception. You should thrill a good 40, 50% of the people that you work with, right? And there's always going to be a few outliers here and there that you can't help. That's realistic, right? But set a high bar for yourself, because I so get what Jodi's saying. This lights you up. It makes your day. You want people this thrilled. You want people saying, oh my gosh, I have tears running down my face. I never thought that the pain would go away. I can't even believe how good I feel. That's not hyperbole. When people really feel that good, they tell you, they need to impress upon you just how big of a deal it is. And then they naturally want to get back to you for reciprocity, because they just got to pay it forward. I ask that you set a high bar for yourself. And regardless of how you get that really elevated level of capability and confidence, please get it for yourself, because we need you playing that level of game in this field, right? We need you that on fire. This is not an exaggeration. I want this for you often. I want this to be a regular event, because I know Jodi gets it. I've had the pleasure of seeing it, but Jodi's also not an outlier. There are lots of practitioners who receive this type of raving fan feedback and gratitude on a regular basis. And so I want you to reach for that.
Yeah, you took the words out of my mouth, Tracy. We go to the SAFM retreats, and I have a lot of students come up to me and say, thank you so much for mentioning this about this school in your group. I cannot believe the difference that has made in my practice. And this is from a lot of the practitioners who have been to 4 or 5 other functional medicine programs. They've done extensive study. These are not beginners necessarily, but if you're a beginner, that's okay too. This program's for you, but you're going to get the nitty gritty things that fill in the blanks for you. So you really get that confidence, that deep level of confidence. And I will tell you, I feel like now when people come in to work with me, no matter what their situation is, whatever their health challenges are, I know I can help them. And can I get everybody 100% better? No, maybe not. Yep. Maybe I can get them 80 or 90% better, and they feel fantastic and they're ready to go tell everybody about me. So, and I'm not alone in this. My colleagues all tell it. We all have the same stories and level of success stories. And I'm telling you, people have told me they've raised their rates triple what they did before they started SAFM. And I know that's not why you got into medicine necessarily, but it's nice to have a really thriving practice that affords you freedom, that you're not burned out taking patient after patient and not getting results. So this is kind of, this is just such a great recipe for not having the burnout. But Tracy, do you want to speak to what the course includes?
Yeah, sure. Thank you, Jodi, because this is an offering we just put together about 6 months ago. And I'm super excited because this for me is the curated best information we have, right, about the gut. And it is 12 hours of webinar. It's literally, I'm not exaggerating, several hundreds of clinical insights and practical case considerations, including a lot of commonly overlooked, just like in the cases I described to you today, contributors to gut dysfunction, including many underlying, like down deep in the cake, drivers for recurrence. Because our mission, my personal passion is healthcare transformation. I love educating students. I love seeing these amazing individual results, but we all know there is a massive mission out there that makes all of our hearts sing about healthcare transformation, which really requires that all of us out there are doing this work and having dramatic clinical outcomes, not just for patients, but also for yourselves, because this work needs to be sustainable. And like Jodi said, part of that is abundance. And yes, you can have a sliding scale. Yes, you can have a variety of programs that have different entry points and these types of things. But you need financial abundance in order to do this work with an open heart and with commitment and strong investment of your focus and your expertise and your time. This course is a wonderful overview, I think, for any modality and any expertise area. Because whether or not you love it and can't wait to have more and stay with us at SAFM for more training or not, what I know is that if your expertise is about fertility, you have to master the gut. If your expertise is autoimmune disease, you have to master the gut. Type 2 diabetes, asthma and immune hypervigilance, long haul COVID, longevity. You've got to master the gut in all of those arenas. So if there's going to be one place where you want to have that whole other echelon of capability, then the gut, we know, is what is the underlying cake of all the different manifestations of disease. And in fact, for this particular course, I want to highlight that from a bonus viewpoint, we included in this course a big chunk of our key content around optimizing clinical engagement. And this part is not specific to the gut. It's that devil in the detail. How do you actually interact with the patient to get the great outcomes? Because we know you could have all the right answers and still fail to help an individual to get amazing results because the clinical encounter is not being optimally managed. Right? There's an art and a science to that. And so we included a good chunk in one of the modules on how to avoid the most common missteps and what to do instead, which is immediate value that goes beyond the gut. And on top of that, you actually can use this course to stay on top of your required CMEs, right? Everything we do here at SAFM is accredited. You can stay on top of your credential requirements, actually doing something transformative rather than just quickly doing something to check the box, right? So you can earn up to 10 CMEs for this particular item.
And
But
10 CEs as well for those of you
yes.
nurses. Yep.
Yep, definitely. But beyond that, I also want to speak for a moment about the power of case practice, because as a very special insider opportunity that only students of this particular course get, you will have an option to opt into ongoing complex case practice every single month for less than $1 a day. This is crazy. We've never offered anything like this at SAFM, but for me, this is an outgrowth of, I need the travesty of people being well-educated and credentialed, but not widely satisfying their patients and clients in clinical practice. I need that to stop. We've got important work to do in healthcare transformation. I need full practices with a lot of raving fans, with raving testimonials that bring more and more and more people to the capability of functional medicine. Right? Because friends, we need to be publishing case studies. We need to be attracting funding for large trials. If we're going to transform healthcare, we got to get going with a boatload of amazing testimonials and amazing case results that can withstand the scrutiny that takes us to this next level of industry change. And so my passion for this goes way beyond the coursework. I want you to be wildly successful because before I die, I want there to be major widespread transformation in healthcare. And I know it's possible. I know we can do this, but we got to get busy with impressive case after impressive case and start publishing, which is something SAFM is getting organized to do and really help drive in order to help with the greater and greater intervention of functional medicine internal to the current models, and not having the legs cut off of functional medicine capability because of the constraints of the system, but also working creatively to help integrate the power of functional medicine into today's healthcare system. We're seeing it work already in really small, impressive examples, but the path forward involves more and more and more existence proof. And I need you to work with me and all of us together as a community in order to make this happen. So yeah, I'm on fire to give you what you need in order to have these raving fans and to get these kinds of results, right? And not just slightly improve your clinical outcomes, but dramatically improve your outcomes and make you an expert in your field that's well known, and let your raving fans fill your practice. That is not a pipe dream. I see it happen frequently in our practitioner community. Sorry, I get fiery, Jodi.
That's okay. I want to just show you some really amazing testimonials. And this is specific to this course that we just opened up 6 months ago. Again, this is not offered year round, by the way. This course is only offered now. So take advantage of it, because the doors close and you may not, you won't get a chance later. But anyway, this course has been so informative, thorough, detailed, well-organized, insightful, clear, thought-provoking, well-researched, intellectual, with facets of biology, chemistry, and physiology, and such a fantastic deep dive into functional medicine and the interconnectedness of the gut with the entire body. Tracy, you're one of the most intelligent and incredible teachers I've ever had. So I have to concur, best teacher I've ever had by far, and just teaches in a way that makes it easy to understand and implement in your practice right away, because all the functional medicine knowledge in the world isn't worth a penny unless you can go ahead and use it effectively in your practice. So I know, Tracy, that's why you started SAFM, because you had a ton of functional medicine education, but you weren't quite sure how to use it. Took you years of learning and figuring it out on your own. And you wanted to teach people like me and the people in this group how to do this work. So, and you can see how excited people are about these course. Has another testimonial from a doctor, Dr. Nancy Sturtz. And she says it's packed with useful information in an organized fashion. She loves how Tracy teaches. Dawn is a nurse practitioner who said there's lots of great information and it's all applicable to clinical practice. Tracy did a great job explaining it all. He has a registered dietitian, also Krista, who says it certainly will make an impact on my practice and future patients. So we get testimonies like this over and over again. There's another one here about just giving me a new level of excitement about helping some of my own difficult to treat patients. That's a PA. And these are all practitioners just like you that are doing this work. But I want you to really think about investing in yourself. This is not a lot of money, folks. $497 for this kind of education is just a steal. And you know, this, like I said, it's an investment. If you get one new cash pay patient from this, it'll pay for the whole thing. But you want to show up with your passion, get raving referrals from your patients, become really an expert in your field. I have people coming to me worldwide. I guess somewhat famous because of what Tracy taught me. And it just gives you this level of people just come to you and they don't even flinch about what your price is. They just want to work with you no matter what. So you're going to get this financial abundance. You're going to be able to give what you have to offer, why you got into medicine in the first place, and really get people healthy and get them well. And don't, instead of having this emotional drain now, which I'm actually going to have Tracy speak to, but don't wait for this and don't become stuck in what you're doing now. Tracy, do you want to speak to this?
Yeah, no, I asked Jodi to include this graph because, like I said, it breaks my heart. And I mean that very sincerely. The number of people that I have spoken to who are just frustrated because their status quo is untenable. It's frustrating, it's demoralizing, but they're not taking steps to change their status quo. And the reality is the future is going to come, right? It's a given. We will be here a year from now, 2 years from now, 3 years from now. And the reality is your future professional development and personal level of fulfillment going to get worse, or is it going to get better? Because I can tell you from supporting thousands of practitioners over the years, it's not going to stay exactly the same. And frustration can turn into physical illness in your body. You can scramble more for how am I going to make this work financially? I'm not making enough. I've got to keep my day job. I've got to do too many things. It's not successful enough. I'm not getting referrals. I'm spending too much time doing marketing as opposed to the clinical work that I love, and I'm disillusioned. Again, I don't want that for you, but we also need your passion and your expertise to change the industry. What I want for you is growth and financial abundance. And what an awesome place to be that Jodi described, where you're hesitant about posting something because you know you're going to get a lot of people, like I said, wanting to be added to your docket when you know they're just going to go on the waiting list and they have polyautoimmune disease and I can't really make them wait, but I don't have any place to fill them. And I can't find anyone to hire right now. We're already over the top busy. Those are the challenges you want to be working with, right? Not, oh my gosh, I need 10 more clients in order to pay my bills, in order to keep things going. And there's so many different business models in which functional medicine can be effective. This is something we also teach at SAFM, right? In terms of all the different ways in which you can do this work. But I need you to be fulfilled. I need you to be financially abundant. I need you to have that deep sense of fulfillment that you are creating raving fans, because that is what will keep you doing this work 5 years from now, 10 years from now. There's way too much of a precedent for everyone who gets into functional medicine is overwhelmed or exhausted 2 years later, 5 years later, and they can't stay. They burn out like a brief flame in doing this work because it's exhausting. And it just doesn't have to be that way. It just doesn't. And our mission for healthcare transformation needs a different future. So I just want to encourage you to make emphatic choices, right? Because the default doesn't ever take any of us where we want to go, right? And we want you to be on an upward swing toward really achieving the greatest vision of yourself and doing this work and not settling for something subpar, much less something frustrated and stressed. You're not going to do your best clinical work when you're frustrated and stressed and desperate for where your next docket of clients is going to come from. I hold a bar for a much higher and better possibility for all of you. I really do. It's a huge area of personal passion for me.
And, you know, even if you're in a traditional practice, I think that a Western practice, and you're implementing this into your practice, you can have such better patient outcomes, and it can open the door for so many more things that you can do, like group programs and things to really help your patients on a whole new level.
Yeah, all sorts of things within the constraints of managed care. Yeah. Totally. Yeah, it's I appreciate your affirming that, right? Because for me, clinical outcomes is not just about the patient, it's also about the practitioner, which for me is just as important. And over the long haul is more important, right? Because that sustainability is the only thing that's going to see us through to the bigger mission.
Definitely. Well, so anyway, I want you to know that you can take this is a bit of a spoiler alert, but if you take this program, you're going to get a real jump start on your learning. You can sign up for the course today. You can start learning today and already tomorrow have better patient outcomes. So because you're going to get concrete things that you can take to your practice right away. So you can self-pace it over the 6 weeks. There's great 6 modules to go through in the course. And this is the spoiler alert, okay? At the end of this $1,600 course that you're getting today for only $497, at the end of the course, you're going to have the opportunity to take that $497 investment and put it towards the certification. So the certification, it's like getting this course for free if you decide to do the certification. And this kind of give you a proving ground for Tracy to see if it's for you, if you want to continue your education and get this certification, which is 100 CMEs or CE credits, which is just incredible over a couple of years. But it also, when Tracy will tell you at the end of the course that there'll be also a $1,000 discount on the certification right during that window so it's like $1,500 off right away on the course, on the full certification if you decide to do that. And I just want to say, I sincerely owe the success of my practice to Tracy. There's no way I could be doing what I'm doing today. And I just think about the days I was really stressed out, waking up in the middle of the night because I was worried about meeting with, my client Carol, who was coming in on Tuesday, and I'm wondering what I'm supposed to do. And she's not getting good results. And, what am I going to do for this person versus now? I mean, I can't believe the difference. And so just know that this course, again, is not offered year round. And again, you can use it towards your full program if you want to do it. But if you go ahead and sign up today, you will not regret it. You could start learning today and implementing this right away into your practice. So it's a write-off too. It's education for your practice. So, and a lot of you get continuing education allowance too. So you could put this towards that as well. But anyway, I want to thank you all so much for coming today, and we will stay around and answer questions. I know some of you might have to go, but we'll stick around and answer some of the questions that are here today. But thank you so much. Any parting words before we go into questions, Tracy?
No, I just want to say thank you, Jodi. It's I love speaking to practitioners about holding a space for greater possibilities. I really, if you leave here with literally nothing else that I can humbly offer, I hold such a strong vision for what I know is possible for you, and possible professionally, possible financially, possible energetically, emotionally for you. I want that higher possibility. I think too many practitioners settle for less. You deserve more than that. What you do is astoundingly important and honorable, and you deserve to have abundance in all of those areas of your life. And like I said, it's just a huge part of my personal commitment and calling. So if nothing else, my hope that is that everyone walks away from today with a broader perspective and a higher level of expectation for what is possible and for what you reach for. However you reach for it, that resonates with you, reach for something truly transformational, because I think you deserve that. I want that for all of you.
Well said, Tracy. Just a couple follow-up questions. Bria is asking from the case study with Marilyn, and this is of course, one of the students that was working with Marilyn. So I don't know if you're going to know the answer to this, but she's asking, basically, you found this from just asking her health history. You found all these nuances.
Yes.
Yeah.
Well, not just health history, right? But good, keen questioning. And this is a key part of that savvy clinical partnership that we were talking about. The reality is that there are a number of contributors to disease dynamics in the gut and elsewhere, by the way. It's not limited to the gut, that we don't have good laboratory mechanisms of measuring them, right? We, for example, don't have a way of measuring things like estrogenic effects. We can measure levels of endogenous estrogen. We can measure levels of a given xenoestrogenic chemical, but we don't measure overt receptor function for any hormone. We're not able to measure exactly how are all these things colluding to create this effect to manifest as this particular symptom presentation. And so there's a lot of puzzle piecing that you've got to get really astute at doing in addition to or separate from the labs. And this is where a good, keen inquiry into a person's step-by-step daily habits is essential, right? You want them to line up all of their personal hygiene products and beauty products and take a picture and send it to you. Right? You want to do a deep dive into, like I said, going far back in history until you find really high yielding pearls of insight. And so, yeah, there's lots of things that labs can be really valuable for, but there's lots of things where labs are useless for them. And in some cases, I think they can actually send us down a rabbit hole that doesn't matter that much. Just because the lab is glaringly abnormal doesn't mean that that's the major outlying factor in their case. And sometimes labs can be distracting. So we want to develop the ability to be a keen expert in using both quantitative and qualitative information about a case. And how do you glean that carefully from each unique individual? There's both science and art to that.
And I love how we talk about the revolving door of gut infections, where, you know, you could do a stool test, you could do all these tests, and of course, stool tests are valuable when you need to be doing them. But the people you solve their H. pylori, you solve their all the things, and then 3 months later, you didn't address the root causes. So 3 months later, they're back with the same, you know, a new stool test, a new set of dysbiosis and other issues, right?
Well, and even taking a stool test, right, Jodi, to your point, you know, we talk about this all the time. Just because you run a stool test and I don't know, there's no steatocrit, you cannot assume optimal hepatic biliary function. You cannot. Just because there's no steatocrit does not mean that there's not poor gallbladder emptying, does not mean that there's fatty liver despite optimal LFTs. You cannot assume those things. And that's a great example of how so often we see the labs are not only normal, but they're optimal. And we think, oh, well, that's not the problem. We can't assume that. This is where you've got to keep that keen beginner's mind and get out of black and white thinking. And a lot of case practice will really hone that skill.
Absolutely. There's a couple comments on order of operations is of paramount importance. Jen is saying she appreciates the approach of not just giving information, but putting the learning into practice via case studies. And I will say that really is where the rubber hits the road with this program with SAFM, because other training doesn't really offer. They either offer just case studies or just the knowledge, but not the sweet spot of both. And I know going through the actual certification, there's over 50, there's actually hundreds and hundreds of case study examples, but you're going to be doing like dedicated case studies over and over and over again. And so that's where you get the confidence, because you know you're learning through those case studies and real life challenges how to do this work. So I love that too.
Yeah. I just want to highlight what you said earlier also, because this was something, I mean, you do get to be known as an expert and you feel really confident doing things like supporting polyautoimmune disease. right? Which is really complex. And very often people are coming in the door, to your point. I mean, I can't tell you how many times I personally have worked with someone who's already been to literally 5, 6, 8 functional practitioners. And I've got thousands of lab panels to show for it, thousands of dollars of lab panels. And here's a recommended list of 20 supplements, but those people are not better, right? And they're deeply frustrated because they've spent a ton of money, which they were willing to do. They were willing and able to do, but they didn't stay with that practitioner because they weren't seeing progressive results. It was either too slow, or it was not comprehensive, or it wasn't the right order of operations. That's just ineffective application of functional medicine science. And once you experience in case studies and an experience in your own watch, being able to really get your hands around those complex cases, yeah, bring it on. Complex case, I'm ready. Let's see what your litany of, 70 symptoms and 5 diagnoses is. Because these are the people who are suffering mightily. They've likely been suffering a very long time. And if you can really help them, they literally will not stop talking about you, which is a huge blessing that everyone can humbly benefit from. It's a serious win-win. Many practices have been ignited by that. I helped one woman who on last count had sent me more than 30 people. And then, of course, some of those 30 people are also big connectors, and they send you a dozen people. And, it's like that old, they told 2 friends, they told 2 friends, and so on. And before you know it, you have a full waiting list that you've capped, and you're having to send people in your referral network because there's no way you can help these people, and you can in good conscience make them wait longer. I mean, that's the reality. So if there's any of you out there doubting that demand for this service and paying well for it isn't massive, please, I have the visibility to know there is massive demand for this, right? You've just got to get started, and you've got to wildly satisfy a reasonable subset of the people you're serving. You can't mildly or largely satisfy all of them, or even a portion of them, and expect to get the raving fan dynamic going on. Your results have got to go to a higher level.
Absolutely. Well said. And Heather's saying, I love this course so much richness. It truly gave me confidence in supporting my clients more deeply. And I have to,
Oh, that's awesome.
agree.
Thank you, Heather. That's great.
Yeah.
So humbling. It's the power of information. And I also want to say, I didn't invent functional medicine, right? I stand on the shoulders like everybody else of the early pioneers, right? Dr. Jeffrey Bland and Dr. Sidney Baker, and even my mentor, Dr. Mark Hyman. So many people who decades ago started this science and this momentum, right? I'm just doing what I know is a critical role for igniting it. And we stand on the shoulders of so many pioneers and practitioners and scientists. And it's a really, really privileged place to be. I'm really grateful for it.
Me too.
So thank you for letting me be here today, Jodi. I really appreciate that, and allowing me to speak to one of your communities.
Thank you, everybody. Take care. Sign up today so you don't forget, and you'll start learning right away. Just block some time off, 3 hours a week that you can put towards this, and you've got this done. Take care, everybody.